You know, we've all been there. Whether it's a throbbing headache, a surprisingly sharp paper cut, or a nagging injury that just won't quit. Pain? It's something every single one of us experiences. But it's also incredibly complex. Think of it as your body's own built-in alarm system. So let's really get into it and understand how this thing actually works.
So think about this for a second. A tiny cut, a deep ache, a sudden sharp impact. What on earth could they possibly have in common? Well, the answer is they all trigger the exact same system. This really sophisticated, personal, and honestly often misunderstood response that we just call pain. They kick off this whole cascade of events in your body that goes way, way beyond just saying ouch.
All right, so here's our game plan for this explainer. First, we're going to break down what pain even is. Then we'll look at the different ways it's classified. After that, we'll follow its lightning-fast journey to the brain, see how it affects your whole body, and finally, look at how we actually measure and manage it.
Okay, so first things first. Before we can really understand pain, we've got to have a clear definition. What are we actually talking about when we say something hurts?
Now, check out the official definition here. There are two words that are absolutely crucial: sensory and emotional. This tells you right off the bat that pain is not just a physical thing. It is a full body experience that involves our feelings and our psychology, all tied to damage that's either happening or that our body thinks might be about to happen.
But then you get this quote from Margot McCaffrey, a total pioneer in nursing, and it hits on an even deeper truth. This idea has become a guiding principle in medicine, and for good reason. It says that pain is, at its core, completely subjective. There's no machine you can hook someone up to that measures it perfectly. The ultimate expert on a person's pain is, well, the person feeling it.
And this is exactly why two people can have the very same injury but have totally different experiences. It's why one person can have a small cut and be in agony, while someone else with a much worse injury might handle it differently. Because at the end of the day, no one else can feel what you're feeling. Your pain is yours and yours alone.
So if it's all so personal, how can doctors and scientists even talk about it in a useful way? Well, they've come up with systems. They classify pain into different categories so they can better understand what's causing it and hopefully figure out the best way to treat it. Let's dig into the main types.
Probably the most common way to slice it is by how long it sticks around. You've got acute pain, which comes on suddenly. Think of an injury. It usually lasts less than 6 months, and most of the time, it goes away as your body heals. Chronic pain, though, that's the stuff that lasts longer than 6 months. It can creep up on you, and it persists, sometimes even getting worse over time. It can become its own disease.
We can also classify pain by why it's happening. Physiologic pain is what you might call normal pain. It's your body's protective alarm system working correctly, like when you pull your hand away from a hot stove. That's also called nociceptive pain. But then there's pathologic pain. This is different. It's caused by disease or actual damage to the nervous system. The alarm system itself is broken and sending out false signals. That's what we call neuropathic pain.
You know, when you stub your toe, the feeling is instantaneous, right? Bam, it just hurts. But what's wild is that the signal actually has to take an incredibly fast 4-step trip all the way from your toe up to your brain and back again. Let's trace that millisecond journey. This whole thing happens in less time than it takes to blink. Let's go back to that stubbed toe. Step 1 is transduction. The physical impact on your toe gets turned into an electrical uh-oh signal by your nerve endings. Step 2, transmission. That signal zips up your spinal cord to your brain. Step 3 is perception. This is the big moment. Your brain gets the message and goes, yep, that's pain. And finally, step 4, modulation. Your brain immediately sends signals back down, kind of like turning a volume knob, trying to dial down the intensity of that pain signal. Okay, so pain isn't just a little alert happening in one spot. A serious injury or a chronic condition doesn't just affect your knee or your back. It triggers a system-wide red alert that affects your entire body and your mind.
So physically, your body basically hits the panic button. Your endocrine system floods you with stress hormones like cortisol and epinephrine. Your metabolism can get all out of whack, sometimes leading to things like insulin resistance. And your cardiovascular system kicks into high gear, jacking up your heart rate and your breathing. It's a full-on, body-wide emergency response.
And the mental side of it, wow, it can be just as brutal, if not more so. Serious or constant pain can lead to insomnia. I mean, how can you sleep when you're in agony? It can cause intense anxiety, restlessness. And in the most severe cases, with things like cancer pain or sickle cell disease, the pain can be so overwhelming that it can lead people to just want it all to be over.
So given everything we've talked about, how subjective it is, how it affects your whole system, how did doctors actually go about measuring and managing it? This is the real challenge, trying to take a personal, internal feeling and make it something you can actually treat effectively.
I'm sure you've seen this a million times at the doctor's office. The most common tool in the box is the numerical pain scale. You're asked, on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain imaginable, where are you at? It's not perfect, not by a long shot, but it gives everyone a simple, common language to talk about how intense the pain feels.
But a real assessment is so much more than just a number. It has to start with just listening to the patient. A physical exam can tell you a lot, and a doctor might watch to see if you pull away when they touch a certain spot. They'll also check your vital signs. If your heart rate or breathing is up, those can be real objective signs that back up what the patient is saying.
And managing pain involves a whole toolkit of strategies. Sometimes just simple reassurance and emotional support can make a world of difference. Simply positioning your body differently to take pressure off a sore spot can be huge. Of course, there are medications, but other things like hot or cold packs can be incredibly effective at giving some relief too.
So we're left with this one final thought to chew on. We spend so much time treating pain like an enemy, something we have to fight and destroy. But what if we reframed that? If pain is truly our body's personal alarm system, a signal that's unique to every single one of us, then maybe the real goal isn't just to silence the alarm, but to get better at listening to what it's trying to tell us.